it's been 11 days since 19,000 doctors down tools after months without pay. As a result, patients are being turned away from hospitals and doctors are leaving the country in droves. All these while Nigeria battles sweeping COVID-19 infections. Arise correspondent Ahike Chude reports.
It couldn't be happening at a worse time. 19,000 Nigerian doctors are on strike. That's while Nigeria is battling an avalanche of COVID-19 infections powered by the latest Delta variant. This is the National Trauma Center in Nigeria's capital, Abuja. Between the latest doctor strike and the demand for doctors at COVID-19 isolation centers, the corridors, wards, and operation theaters of the hospital are mostly deserted. One doctor, still on duty, says this strike is more drastic than previous ones.
Right now, the response is poor because the resident doctors form a huge number of those who mount the response against the COVID-19. Most of the isolation centers in the country are actually run by resident doctors. For one, I know the one in our center here is run basically by the resident doctors. And this strike is a different kind of strike. Most other strikes that will go on, we leave those who cover the isolation centers to work, but this is different. Even those that work in the COVID isolation centers have been withdrawn, their services have been withdrawn.
As doctors remain unpaid, it's the patients who are paying the price, like Jennifer Odiaze, who's in her third trimester of pregnancy.
I came here for my routine check and there is no doctor to see us. We've been here since 7 o'clock a.m. Nobody, just the nurses. So the matron had to even call the doctors to ask if any of them will be coming. But there was no positive response, so they asked us to go back. It's very terrible.
It's a situation that doctors call regrettable, but necessary. After signing a memorandum of understanding in April, which brought a 10-day strike to an end, the Nigerian Association of Resident Doctors say their demands have not been met. Salaries remain unpaid, and benefits for the families of doctors who lost their lives on the front lines of the pandemic still haven't come through. Nigeria's Labour and Employment Minister Chris Ngige, as well as Nigeria's Health Minister Dr. Osagie Ehanire, have both insisted that they are committed to ending the strike and returning doctors back to work. But the Health Minister has also admitted that a lot of the doctors' demands can only be met by state governments and not his federal ministry. And with the COVID-19 pandemic still such a stark reality across Nigeria, reaching a long-term solution to doctors on strike is proving difficult. Adefemi Akinsanya, Arise News, Lagos.
It really is proving difficult. Let's bring in public affairs analyst Ahike Chude to help us, with his views on this. Thank you so much for joining us on Newsnight. Well, the federal government is insisting through the Minister of Health, Ehanire, that it will implement the no work, no pay rule, and of course, as put in place by the International Labour Organization. What do you think about this? Government says it has no other choice.
Well, the government keeps on relying on the same old methods that do not work and cannot work. This is not the first time that the government is threatening no work, no pay. They have done that with ASU, they have done that with NASU, they have done that with so many other unions in the country. They have done that with the TUC, the NLC, and all that. And it does not work because ultimately, at the end of the day, everything ends at the negotiating table, and then they find out that they cannot implement all of those things. I think they should look for more holistic ways of approaching the issue and not issue threats to the doctor. Don't forget instances where the government was a loggerhead with some unions, and they were compelled, the union members, to fill registers and so on in the universities and some other places. So we've seen this thing several times, and then it's just a justification of that saying that it would appear that our elites have learned nothing and they have forgotten nothing. It's not going to work. They should look for a more enduring solution to this crisis that is bedeviling the healthcare sector in the country.
the negotiating team, both Ngige, because Ngige said something like the Minister of Labour, that's Ngige, he says he's not ready any longer to discuss with the resident doctors. You know, he said that. And Hanire just said a while ago that what should be done is for the doctors to continue talking until a solution is arrived at, because the no pay, no work is included in the ILO, statutes. What do you think?
Yeah, well, they are the ones interpreting the statutes of the ILO, and I'm sure that the doctors will tell you that they are standing on firm grounds when it comes to the actual interpretation of that particular statute. And so I'm not surprised that Ngige is saying that they're not going to talk to them anymore. This is the same person, he's a medical doctor, who said that Nigeria had more than enough doctors to take care of the citizens. Of course, you know that accepted United Nations doctor to population ratio is 1 to 100. In Nigeria, it's about 1 to 5,000, 1 to 6,000. It's a horrendous situation. And of course, even as we are talking today, international other countries, in Europe, are placing adverts in the Nigerian media space, asking health workers in Nigeria to come over to their country so that they can be better taken care of and all that. So then doctors obviously are an endangered species in this country. And so something drastic must be done by the federal government to protect this segment of our population, because they are doing very critical services. Of course, they have said that this action is highly regrettable, but it's something that had to be done. About 19 doctors lost their lives during the current, COVID-19 pandemic. Nobody has talked about, their families. Some of these doctors are the breadwinners of their families. Their wives do not have any work to do. How do you even expect them to get to work, even in the first place, with the cost of transportation and every other thing? So we are talking about a real existential situation for the doctors. And I have always maintained that it is a very difficult situation for unions, especially at the national level, to have to call out their workers to go on a strike, because it takes a lot for them to call them out, their members to go out on a national strike, especially at the level of healthcare. And so it's an unfortunate situation, like I have said, but it would appear that the government has not learned to give the right kind of priority to the issues of the Nigerian nation. You cannot joke with healthcare. Don't forget what Bill Gates said when he came to Nigeria, that 2 sectors that the government must do well to invest in so much, adequately, is education and healthcare, because this is the basis of national growth and national revival and national renewal. And obviously our politicians this is the 4th time. Every time these unions have agreements with government. And in most cases, if you look at almost 100% of the time, it is the government that willingly enters into an agreement with these unions that unilaterally, withdraws from such agreements. I think it is reprehensible. It is unfortunate. I do not blame the doctors. It's unfortunate. I'm sure that their hearts must be going out to the patients. I'm sure they are not exactly happy with what they just have to do, but it is something that they have to do. And lastly, I will just say that ultimately, the doctors are going to have the last laugh in this country. It's not the government. We just saw the Olympic Games, recently, where a lot of Nigerian athletes were running for other countries. I'm sure their hearts must be bleeding that they are not doing this for their country. So these are the issues. Ultimately, at the end of the day, if you make things more difficult for these doctors, they are all going to look for a way to leave this country. There was a survey recently, not too long ago, that out of every 10 doctors in this country, 8 are looking for a way to get out of the country. Who is going to treat our citizens? And you know why this is happening? Because right now, the president is abroad, on healthcare, treatment, and most of our politicians, that is what they do. So ultimately, it doesn't concern them. If they were going to our hospitals for treatment, I can assure you that our hospitals are going to work. They know what to do. They have just refused to muster the proper political will to do it.
That you raise there, Ahike. Well, the health minister says it is unconscionable on the part of doctors to embark on a strike at a time like this, when Nigeria is battling the 3rd wave of COVID-19. There is cholera outbreak, and on the other hand, again, there's the Marburg, virus outbreak. Would you say that it is unconscionable? Is it a good time for the doctors to be going on this strike. Can Nigeria afford this strike at this time, really? And what are the long-term implications for Nigeria's health sector? You've just talked about the possible brain drain that could happen within this period. Address that.
You see, this is the issue, and my heart bleeds looking at hearing, seeing what goes on daily in our country. The fact that almost everybody feels that the best way to better their lives is to leave the shores of this country, I think it is something that is harrowing, and we must look for a way to tackle some of these issues. Look, it is a difficult situation for the doctors to find themselves in this situation, but you will know, regardless of what they are telling us. The budgetary allocation to the Ministry of Health is about a pitiable 4% of the national budget. And during this COVID, of course, there was an extra 72 billion that was released by the government. And the African Union specifically said that for the period of the COVID-19, that about 15% extra of the country's national budget should be released for the purpose of healthcare because of the COVID-19 situation. That has not happened, and so the doctors find themselves in very difficult situation. I told you that about 19 doctors had died from COVID-19 from last year. Nothing has been done to their dependents, and so a lot of them have had to work under very hazardous
For now,
conditions.
Ahike, thank you so much for your contributions. Ahike Chude, their public affairs analyst.